I'm John Clark. I'm a postural alignment specialist certified by the Egoscue Institute to teach postural therapy. Today, we're going to be talking about one of my favorite E-sizes, static back. This is a great one for anyone just starting out with postural therapy because it is a passive stretch, does not require a lot of effort, and it can be really effective at mitigating lots of different types of pains from low back to neck to even hip or knee pain. So, as I mentioned in the introduction, static back is one of my favorite E-sizes. I just love this position. As you can see, it's a very simple stretch or position, whatever you want to call this. I am simply laying on the ground with my hips in 90 degrees of flexion, meaning my knees are directly above my hips. My knees are in 90 degrees of flexion as well, meaning that they go straight out from here. The bench isn't so high that my leg is in less than 90 degrees flexion, and it's not so low that my knee drops into more than 90 degree flexion. This is all right angles. My upper body is horizontal, upper leg is vertical, lower leg horizontal. All 90 degree angles. And when I first started out postural therapy, this was one of the only exercises I could even do. I was in a wheelchair at the time, and I would get down on the ground, and I got a static back, and I remember the first time after about 10 minutes, I started to feel things change, and I got addicted at that point. This is a great passive E-size for people who are in so much pain that they can't even move, especially for like lower back pain or hip pain, things like that. Neck pain, this can be great for. And or if you're just feeling so demotivated that you can't even get started, sometimes I'll sit in this position for 20 minutes or something before I do any other E-sizes. Or sometimes that might be the only postural therapy I do for a day, and I call it at that, and that's okay. I remember when I first started, I would spend hours in this position over the course of a day, and that was how I got myself started. Now, another reason why this is one of my favorite positions or favorite E-sizes is that I can do so many different E-sizes from this position. I have another video about knee pillow squeezes that I've recorded just today, where you have a block between your knee and you're squeezing it. That's a great E-size. I'll just go through. I'll be making videos for all of these E-sizes eventually, but here's kind of the gist of it. I can do reverse presses where I work my scapular function. I can do pullover presses where I'm working scapular and shoulder function. I can do pullover presses rather. These are just pullover presses is where I'm pushing into a block maybe like this. This is great. That's great for loosening up the lower back and increasing strength in various parts and aspects of the shoulder. I can do foot circles from this position, points and flexes. I can have straps around my knees. I can do blocks or straps at the ankles. I can do, what are these called? These are pull backs, that type of exercise, where I'm strengthening and improving my hip function. That's just like a fraction of the E-sizes I can do from this position. I can even use weights and do tricep extensions here. I can do what's called double doubles or double switches in this position. It goes on and on and on. I can do abdominal crunches in this position. There are just so many things I can do from here. I can develop a whole menu just in static back. And that is just such a versatile position, highly modifiable. If you have pain in I can't quite reach it from here, but if you can't get your head onto the ground, you can put a pillow underneath, and you can still use the position even because some people, their necks are stuck so far forward that they can't get their head on the ground. So you can use pillows if you're having that problem. And it's just a Great position. One of the greatest things about postural therapy right here, static back. I love it.